This is the brachial plexus. It is a large bundle of nerves innervating the shoulder and upper extremity. Coming out from the transverse processes of C5 through T1, it runs between the anterior and middle scalenes. It continues inferiorly and laterally and runs underneath the clavicle to the axillary region. The brachial plexus runs alongside the axillary artery and axillary vein and is located underneath the pec minor. Here is a model of the brachial plexus divided into 5 parts: the roots, trunks, divisions, cords, and terminal branches. You can remember these parts using the mnemonic, remember to drink cold beer. There are 5 roots where each branch of the brachial plexus originates: C5, C6, C7, C8, and T1 vertebrae. The C5 and C6 roots merge to form the upper trunk of the brachial plexus. The C7 root extends into the middle trunk, and the C8 and T1 roots merge to form the lower trunk. Each of the trunks divide into anterior and posterior sections. The posterior section is shown in blue here and extends to become the posterior cord. The anterior divisions lie above and below the posterior cord on this model. The white cord represents the anterior lateral cord, and the green represents the anterior medial cord. Finally, the purple sections of this model represent the terminal branches. Branching off of the anterior lateral cord, we have the lateral pectoral nerve, the musculocutaneous nerve, and the median nerve. Branching off of the posterior cord, we have the upper subscapular nerve, the thoracodorsal nerve, the lower subscapular nerve, the axillary nerve, and the radial nerve. And branching off of the anterior medial cord, we have the medial pectoral nerve, the brachial cutaneous nerve, the antebrachial cutaneous nerve, the ulnar nerve, and the median nerve as well. There are also other branches coming off at the C5 root, and these are the dorsal scapular nerve, the suprascapular nerve, the subclavian nerve, and the long thoracic nerve. The long thoracic also has branches coming off at the C6 and C7 roots. Due to its location, the brachial plexus is hard to access beneath the clavicle and surrounding muscles, which is a good thing because damage to any of the nerves in this bundle can lead to impaired motor and sensory function.
The anterior terminal branches include the musculocutaneous nerve, the median nerve, and the ulnar nerve. An injury to the musculocutaneous nerve is uncommon because of its deep location in the axilla. But if affected, the musculocutaneous nerve will result in a weakened shoulder flexion. An injury to the musculocutaneous nerve could also weaken elbow flexion. Also, an injury to the musculocutaneous nerve could weaken forearm supination. However, these two movements aren't compromised completely because the muscle that acts on the elbow flexion, the brachial radialis, and the muscle that acts on forearm supination, the supinator, are both innervated also by the radial nerve. An injury to the median nerve typically occurs when there's a supracondylar fracture of the humerus. There's a loss of sensory and motor function in the 3.5 lateral digits. This includes the thumb, the pointer, the middle, and half of the ring finger. The forearm and an injury to the median nerve will typically be in supination, and adduction will occur because of the irregular pull on the flexor carpi ulnaris muscle. An injury to the ulnar nerve is also uncommon, with loss of sensory and motor function in the medial 1.5 fingers. This includes the pinky and the other half of the ring finger.
As mentioned, there are 2 posterior terminal branches, which are the axillary and radial nerves. First, axillary nerve injury remains the most common peripheral nerve injury to affect the shoulder. The axillary nerve provides innervation to the deltoid and teres minor muscle. Injury to this nerve is seen after a glenohumeral joint dislocation, a proximal humerus fracture, or a direct blow to the deltoid muscle. Places that are most vulnerable to injury are at the origin of the nerve from the posterior cord, anterior-inferior aspect of the subscapularis muscle, the shoulder capsule, quadrilateral space, and the surface of the deltoid muscle. People who are more prone to this injury are athletes who participate in high-impact upper body activities and people who do repetitive tasks using your shoulder. As a result of injury, one might feel numbness or tingling in the inferior portion of the deltoid. They might feel weakness or loss of movement in the shoulders, and problems with normal physical activities like lifting your arms above your head or difficulty lifting objects. One might experience pain in the deltoid and anterior shoulder. There will be a weakness deltoid and teres minor muscle, which will result in a loss of abduction and external rotation of the shoulder. Lastly, the radial nerve runs down the lateral side of your arm and controls movements of the tricep brachii muscle, the wrist joint capsule, and the dorsal skin of your forearm and hand. Injury to the radial nerve can be from physical trauma, like a glenohumeral and or elbow dislocation, fracture to the proximal humerus, infection, exposures to toxins, and crutches that fit improperly from the excessive pressure. People prone to this injury are manual labor workers, athletes that use overuse of the arm, such as overhead sports like tennis, and as mentioned before, people with ill-fitted crutches. The radial nerve is responsible for extending the wrists and fingers and controls sensation of parts of the hand. Therefore, if you have damage to the radial nerve, you will have an inability to extend the forearm, wrist, and fingers. Wrist drop is common, as you cannot extend or straighten your wrist or fingers when the hand is pronated. Wartenberg syndrome may also happen, where there is an entrapment of the nerve between the brachial and radialis muscle from perhaps wearing too tight of jewelry, which results in numbness or tingling in the radial half of the dorsum of the hands and digits. Due to radial nerve injury, sensation is affected over the lateral and posterior upper arm, forearm, and dorsal surface of the lateral 3.5 digits.
Thanks for watching! And just remember, real therapists drink cold beer!